Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about tinnitus or tinnitus, which is ringing in the ears. So ringing in the ears is a very common symptom in patients who have neuroinflammation caused by infection and inflammation. And ringing in the ears is really the result of what I believe in what's going on with tick-borne illness is that the pressure in the brain from the infections and inflammation are pushing on the cochlear nerve, which I believe is cranial nerve 8, either 7 or 8. And the cochlear nerve innervates the ear and allows you to perceive sounds. And when that nerve becomes irritated from neuroinflammation, it just starts to fire. And then you get this excessive ringing in the ear. On top of which, one of the medications that we use, and in particular in children and in patients with Bartonella, is Zithromax, azithromycin, which is a macrolide, like Biaxin. And one of the side effects is that it does cause ringing in the ears. And if you continue to use it, you can have some hearing loss. So you want to be careful with Zithromax. When the patient begins to have ringing in the ears, you need to change to Biaxin or another drug. Ringing in the ears is one of the hardest symptoms to get rid of. It's as if the cochlear nerve just gets so irritated that it can't stop firing. And so one of the things you can do is increase your fish oil, do all the things that help reduce neuroinflammation. So brain-derived neurotropic factor, Vinpocetine. You can do NeuroNutrients or Cognicare, and try and reduce that neuroinflammation. The other thing you can do is try methylene blue, because methylene blue crosses the blood-brain barrier and gets up there and helps to reduce neuroinflammation. Neuroinflammation is the driving force behind a lot of the symptoms in neurobartonellosis and neurolyme. And so right out of the gate, you want to lower inflammation and restore the blood-brain barrier, because that becomes disrupted as well when you have chronic infection and inflammation. So you want to heal that. And with regards to treating tinnitus or tinnitus, there's not really anything you can do other than reduce or stop Zithromax and go on another drug, and reduce the neuroinflammation by using supplements and methylene blue. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.